Please use subtitle translation to select desired language. Early warning signs of Alzheimer's disease can vary from person to person. Recognizing these signs early can be crucial for diagnosis and intervention. Here are some of the key early warning signs. 1. Memory loss, difficulty remembering recent events, conversations, or information. Frequently asking the same questions or repeating the same stories. 2. Difficulty with problem solving and planning, struggling with familiar tasks, such as managing finances, following a recipe, or keeping track of monthly bills. Difficulty concentrating or organizing thoughts, leading to confusion about steps in a process. 3. Language problems, difficulty finding the right words during conversations, leading to pauses or substitutions. Using simpler words or phrases instead of more complex ones. 4. Disorientation and confusion, losing track of dates, seasons, and the passage of time, forgetting where they are or how they got there. Difficulty judging distances or determining color contrasts, leading to problems with driving. 5. Changes in mood and personality, experiencing rapid changes in mood, often becoming confused, anxious, or depressed. Losing interest in hobbies, social activities, or events they once enjoyed. 6. Difficulty with visual and spatial relationships, problems interpreting visual images, which can affect reading, judging distances, and recognizing faces. Struggling to understand spatial relationships, which may lead to problems with driving or navigation. 7. Poor judgment and decision-making, making uncharacteristically poor decisions regarding money or neglecting personal hygiene. Engaging in risky or reckless behavior without recognizing potential consequences. 8. Difficulty following conversations or TV shows, frequently losing track of conversations or struggling to understand the plot of a movie or book. Repeating the same comments or stories in conversations without realizing it. 9. Misplacing items, regularly putting items in unusual places, e.g., keys in the refrigerator, and being unable to retrace steps to find them. Accusing others of stealing items that have been misplaced. 10. Changes in sleep patterns, experiencing changes in sleep patterns, such as insomnia or sleeping more than usual, waking frequently during the night or having trouble going back to sleep. 11. Neglecting personal hygiene, a noticeable decline in grooming habits, such as bathing regularly, brushing teeth, or wearing clean clothes. 12. Difficulty recognizing familiar faces, struggling to recognize friends and family members, which can lead to confusion and distress. Having an emotional response to familiar faces that seems out of place or absent. 13. Increased dependence on memory aids, using sticky notes, lists, and reminders more frequently to compensate for memory loss. Depending heavily on devices or apps for reminders and scheduling. 14. Changes in eating habits, losing interest in food or changes in eating habits, such as overeating or losing appetite. Struggling to prepare meals or follow recipes, leading to reliance on pre-packaged or convenience foods. 15. Decline in work performance, difficulty completing tasks that were once routine or familiar, affecting job performance. Making more errors or having trouble meeting deadlines. 16. Social withdrawal and isolation, choosing to stay home rather than participate in social gatherings or community activities. Distancing from friends and family, leading to loneliness. Several risk factors can increase the likelihood of developing Alzheimer's disease. While some risk factors cannot be changed, others are modifiable, meaning lifestyle changes may help reduce the risk. Here are the key risk factors. Non-modifiable risk factors. 1. Age. The risk of Alzheimer's increases significantly with age, particularly for those over 65. 2. Family history. A family history of Alzheimer's or other dementias can increase risk, suggesting a genetic component. 3. Gender. Women are statistically more likely to develop Alzheimer's than men. 4. Ethnicity and race. Certain ethnic and racial groups may have a higher risk of developing Alzheimer's. For example, African Americans and Hispanics have been found to have a higher prevalence compared to Caucasians. 5. Low educational attainment. lower levels of formal education have been associated with an increased risk of cognitive decline and Alzheimer's. Education may contribute to cognitive reserve, which can help protect against dementia. Modifiable risk factors. 1. Cardiovascular health. Conditions such as high blood pressure, high cholesterol, and diabetes can increase the risk. Maintaining cardiovascular health may protect against cognitive decline. 2. Lifestyle factors. Lack of regular exercise can contribute to cognitive decline. Diets high in saturated fats and sugars and low in fruits and vegetables may increase risk. 3. Cognitive engagement. Low levels of mental stimulation and engagement can increase risk. Activities that challenge the brain, such as reading, puzzles, and learning new skills, are beneficial. 4. Social isolation. Limited social interactions and feelings of loneliness can contribute to cognitive decline. Maintaining an active social life can be protective. 5. Traumatic brain injury. A history of head injuries may increase the risk of developing Alzheimer's later in life. 6. Sleep disorders. Conditions like sleep apnea or chronic insomnia may contribute to cognitive decline and increase the risk of Alzheimer's. 7. Depression and mental health. A history of depression or other mental health issues may increase the risk. Addressing mental health is important for overall brain health. 8. Smoking and alcohol consumption. Smoking is associated with a higher risk of cognitive decline. Excessive alcohol consumption may also increase the risk of dementia. 9. Chronic inflammation. Chronic inflammatory conditions, such as rheumatoid arthritis or inflammatory bowel disease, may increase the risk of Alzheimer's. Managing inflammation through diet and lifestyle is beneficial. 10. Obesity. Obesity, particularly in midlife, is linked to a higher risk of developing Alzheimer's disease. Maintaining a healthy weight through diet and exercise is important. 11. Diabetes. Type 2 diabetes has been associated with an increased risk of Alzheimer's and other dementias. Proper management of blood sugar levels can help reduce this risk. 12. Heart health. Conditions affecting heart health, such as atrial fibrillation or other arrhythmias, can increase the risk of stroke and cognitive decline. Managing heart health is crucial for brain health. 13. Exposure to environmental toxins. Long-term exposure to certain environmental toxins, such as heavy metals and pesticides, may be linked to an increased risk of cognitive decline. 14. Hormonal factors. Hormonal changes, particularly in women during menopause, may influence the risk of Alzheimer's. While some risk factors for Alzheimer's disease cannot be changed, many lifestyle modifications can reduce the risk. Maintaining a healthy lifestyle, including regular physical activity, a balanced diet, mental stimulation, and social engagement, can help protect against cognitive decline. If there are concerns about Alzheimer's risk, consulting with a healthcare professional for personalized advice and strategies is advisable. This video is intended to provide health information. If you have a medical condition, please seek professional advice. Thanks for watching. Please subscribe, like and share. Your support is my biggest motivation.